Hi, everyone, and welcome. I see several of you getting settled and joining us this evening. This evening is our Pre-Physician Assistant Studies webinar. And here with me tonight is Andrea Garcia. And she is one of our professors here on campus and the director of the Pre-PA program. I am going to turn it over to her in just a few minutes, but I just want to get a couple more people signed in and get settled in. So thank you so much for joining this evening. My name is Christine, and I'm an undergraduate admission counselor here at the university. I recognize some of the names of the students joining us this evening. So some of you are my students, and I'm sure you've heard from me before. Tonight, if you have any admission questions, you can put them in the Q&A chat, and I'd be able to answer your questions. Sarah True is another admission counselor here at the university. She will be behind the scenes as well, answering some of your questions. But it does look like we have a decent amount of students in the webinar this evening. So thank you so much for joining us. Again, this evening is our Pre-Physician Assistant Studies webinar. So I am going to pass it over to, again, Dr. Andrea Garcia, and she'll talk to you a little bit more about the program.
Thank you, Christine. Good evening, everyone, and I want to say welcome to our webinar. I'm going to share my screen with you and present our pre-PA program. Okay, so I hope everyone is safe, well, and healthy during these difficult times. And I want to thank you for taking the time to join us tonight. My name is Dr. Andrea Garcia. I'm the program director of the Pre-PA program, and I'm also an instructor of biology here at University of the Sciences. And I'm going to preface this talk with, typically I take an hour to present this talk, and I am a fast talker, so I will do my best to keep a slow pace. And if you have any questions, if you can just enter them in the Q&A and Christine will answer them, and we should have time at the end. And if we don't, my email address is on the last slide, and you can send me an email with your questions. So first, let's talk about what a physician assistant does. What is the scope of practice for a physician assistant? PAs take medical histories, they perform physical exams, they order and evaluate labs, develop and carry out treatment plans, they educate patients and family, and they promote disease prevention plans for patients. So what else do PAs do? Interestingly, PAs work in every medical specialty in the United States. It can be the first assist at major surgeries, and oftentimes they're the primary healthcare provider in pre-op and post-op visits for patients. They also perform minor surgical procedures, set broken bones, casts, and splints, and they pronounce death and sign death certificates at will. They also can change their specialties at will, and I underlined and bold-faced this one. I'll talk about that more in a minute. But where do PAs work? The short answer is everywhere. You can find physician assistants in hospitals, private practice, and in health centers. So then the big question you might be asking yourself, or at least people my age do, I know, what's the difference between a physician and a physician assistant? I'll use myself as an example describing the physician because that's my background. I'm a retired physician, and the education starts with your four-year bachelor's degree. And I am an alumni of University of the Sciences, and I got my bachelor's of science in biology back in 2001. Yay, USciences! After I completed my four-year degree, I went to Rutgers University to get my medical degree. That was 4 years. After which, I did a residency in internal medicine. That totaled 4 years. And then I wanted to pursue a career in pulmonary critical care medicine, so I did a 3-year fellowship at Thomas Jefferson University Hospital here in Philadelphia. So altogether, 11 years. The physician assistant also gets a 4-year degree and then goes to graduate school to earn a master's degree, which depending on the program is either 2 or 3 years. Here at University of the Sciences, our graduate PA program is 2 years in length, 2 full years in length. Other differences between the physician and the physician assistant, besides the education, which is a major one, is that physicians have an independent practice, whereas physician assistants have a dependent practice and work as part of a healthcare team. We both get reimbursement from insurance companies. Physician assistants, 85% of the physicians reimbursement. We both get CME. We both carry malpractice insurance. And here's the big difference I mentioned before. Say now at age 46, I decide I want to be a dermatologist. I would have to go and do a residency in dermatology. As a physician assistant, you can change your specialty at will. So if you want to work in surgery for several years and then switch gears and then move into primary care, you can do that without completing a residency. Another big question that we get asked is, what's the difference between a nurse practitioner and a physician assistant? The terminal degrees are both master's degrees. You can get a doctorate to be a nurse practitioner, and you can get a doctorate to be a physician assistant. The major difference is the background. So nurse practitioners have their undergraduate degrees in nursing, and the nursing model is more of a holistic, patient-centered focus, whereas the physician assistant gets their 4-year degree in one of the biological sciences typically, but not always. And then the graduate program is more of a condensed medical school curriculum. US News and World Report 2020, the #1 healthcare job is physician assistant, and it was also #1 in 2019. I just wanted to point that out there in case you were wondering where the job ranks as far as job satisfaction. #1 in the healthcare professions. The average salary of a certified PA is $111,000 according to the American Academy of Physician Assistants, and that's up $4,000 from last year. And today in the United States, we have over 123,000 practicing PAs, and that number is expected to increase by almost 40% over the next 6 years. And just a little bit of historical information for those of you who are interested. Who started the PA profession anyway? Because it seems like it just popped up out of nowhere. And we all know that non-physicians have always taken care of pregnant, sick, and injured people. You don't have to be a doctor or a nurse to do that. And the PA profession was kind of born out of military necessity with the military corpsmen. So military corpsmen served at army bases, warships, prisons, and mobile army surgical hospitals known as MASH units. And when these military corpsmen retired, and they wanted to continue practicing medicine, and they were just as skilled as some trauma surgeons. And Dr. Eugene Stead at Duke University decided that there's got to be a way to allow these military corpsmen to continue practicing their profession without having to send them to medical school and internship and residency and fellowship. And he developed the first PA program at Duke University. And the first graduating class was in October of 1967. And here's the picture of those graduating physician assistants. Okay, so how do you become a PA? You come to the University of the Sciences because we're the best program around. You earn your bachelor's degree and you take your prerequisite courses, and then you'll earn your master's degree from a graduate PA program like the one we have at USciences. We'll talk a little bit about that at the end. You're going to pass the PANCE, and the PANCE stands for Physician Assistant National Certification Examination, and then you get your state licensure. But it all starts with coming to University of the Sciences. Now, I do believe that University of the Sciences is the best program around, and it's not just because I went to University of the Sciences. We have this degree, it's called the Biomedical Sciences degree, and it's rigorous and it's flexible. And you can have several foci of concentration with this Biomedical Sciences degree. You can concentrate in neuroscience, clinical science, biotechnology, or physician assistant studies, and that's what the remainder of this talk is going to be about. So our undergraduate pre-PA program at USciences, how do you get in? You need to have a minimum GPA of 3.0, and that's your high school science and cumulative. We don't accept science grades less than a B from community colleges, and we don't accept science grades less than a C from a four-year college. And the reason is because statistical data has shown us that there is a correlation between your GPA and the grades you earn and the probability of passing the PANCE. So we want to make sure that we put you in the best position to excel. And that is the reason why we have these grade minimum requirements. So the pre-PA academics and standards. A full-time student will carry between 12 and 20 credits per semester. You are required a minimum number of patient contact and shadowing hours, and we prefer 50 prior to starting your undergraduate program. I'm going to talk a little bit more about that in a few slides. We look for students who have high science and math aptitude, those who are motivated, mature, responsible, and professional, and have good interpersonal skills, because you're going to be working with patients. So pre-PA at USciences, again, coming in as a freshman, you're going to need to have your GPA at 3.0. And we allow for a lower GPA your freshman year because we realize that it takes a lot out of you transitioning from high school to the university. So we ask for a GPA of 3.0, but then we bring it up to 3.2 for the remaining years at University of the Sciences. You'll take courses in chemistry, biology, math, and physics, anatomy and physiology, pharmacology, microbial science, physical examination, PA interview seminar, and clinical immunology. Okay, now I realize that this slide is busy, but I wanted to put in the curriculum. So what you'll know exactly what you're expecting when you come here. So as a freshman, your first year in the fall, you'll come in with a GPA of 3.0. I have that highlighted in red, a minimum of 50 shadowing and patient contact hours, which we'll talk a little bit more about in a minute. And I just want to point out that the curriculum is very standard across other universities in the United States. You're going to be taking biology, you're going to be taking chemistry, you're going to be taking calculus or pre-calc, writing and rhetoric, and physical education. In your second year is when things get really good. I have highlighted here during your second year, fall and spring, history and physical exam 1 and 2. I have them highlighted because these courses are very unique to this program. We have a clinical skills laboratory, and the history and physical exam skills course is for the introductory student in how to take a good medical history and perform a basic physical exam. I didn't learn this until I was in medical school, and I think University of the Sciences is very unique and wonderful in offering this to you as a second-year undergrad. During your third year, you'll take a course called Medical Terminology, where you'll be introduced into all of the medical vernacular that you'll be using in your career. And then in the spring of your third year, Intro to Pharmacology, which is taught by professors from Philadelphia College of Pharmacy. And you'll also take Principles and Applications of Immunology. And I just want to point out too that we have professors from various backgrounds, and they are all very skilled and very committed to teaching you. And it's a wonderful education that you'll have here at University of the Sciences. During your fourth year, you'll have a course called PA Interview Seminar. And this course allows you an opportunity to hone in on your interviewing skills. We also have a course called Death and Dying, which is also another great course and very unique. You know, in the medical field, we often talk about pediatrics and OBGYN and neonatal care, but very rarely do we talk about death and dying. And the reality is that all of us are going to die. So we think it's important to introduce death and dying during your undergraduate years, so this way you feel more comfortable talking about these topics with your patients. Whoops, I skipped a slide here. We also offer an accelerated 3+2 track for those students who are interested. The 3+2 accelerated track allows you to earn your bachelor's degree plus your master's of PA studies degree in 5 years instead of 6 years. And the way we do this is by condensing the curriculum. And it is rigorous, and it's not for everyone, But for those students who are interested into shortening the duration of their educational path, we do offer that path for those students who are competitive and motivated and want to do it. So I am just going to move through these slides and point out that the curriculum is the same as our 4+2 biomedical sciences track. And if you have more questions about this, you can always email me. I'm more than happy to answer any questions you have about our 4+2 or our 3+2 track. Okay, undergraduate progression on the pre-PA track. So you come to University of the Sciences, you're a biomedical sciences pre-PA major, and you come in with a minimum GPA of 3.0 from your high school and 50 patient contact or shadowing hours. Entering into your second year, again, a minimum GPA of 3.0 is required, and then we raise the patient contact shadowing hours to 150. Entering your third year, your GPA requirement will rise to 3.2, and we'll ask that you have 300 hours of shadowing and or patient contact hours. And then entering your fourth year, minimum GPA stays the same at 3.2, and we ask that you have 100 hours of shadowing plus 500 hours of direct patient care. Now, this is just specific for our program. Other programs will vary. So what's Dr. Garcia talking about? Shadowing versus patient contact hours. The easiest way, I think, to separate the two is to think of shadowing hours as hours where you spend time with a PA, an MD, or DO. You're not getting paid, and you're essentially their shadow, and you follow them around throughout their work day to see what their duties entail. Our graduate PA program requires that you have 100 shadowing hours when you apply to the program. Direct patient care hours, and I have in parentheses 500 hours because our graduate program asks for 500 hours. Direct patient contact hours, I like to think of those hours where you're actually paid to have contact with a patient and you're actually providing care. Common ones are as a CNA or certified nurse assistant, a healthcare aide, an EMT, medical scribe is very popular right now, phlebotomist, respiratory therapist, and even an RN. I also want to mention that depending on the program that you're interested in pursuing your master's degree of physician assistant studies, their hours for shadowing and patient care vary. So it's important for you to look up those universities and find out what their requirements are. The most I've seen is 2,000 hours for patient care requirements. So our graduate education options. In the 3-year accelerated track, which is the 3+2 track, you'll be applying to University of the Sciences graduate program in the spring of your second year. It's a 27-month, year-round PA program at USciences. If you decide to pursue the 4-year traditional track and earn your Bachelor's of Science in Biomedical Sciences, both tracks allow you to earn your Biomedical Sciences degree. But in the 4-year traditional track, you'll be applying to any PA school. Here at University of the Sciences, you get a guaranteed interview when your GPA is 3.2 or greater. And for those students who have GPAs greater than 3.7 and GRE scores that are greater than the 60th percentile, you have a guaranteed seat at Salus University. And that's just for University of the Sciences students. So where do USciences graduates get accepted for PA school? You guys are going to get accepted everywhere. I have a list here of the schools that our graduates were accepted to over the last 2 years. And I'm not going to belabor the point and read you the lists, but you can see that our graduates are accepted everywhere. Just a little bit more about our graduate PA program. Our first class started just this past August in 2020. We have 40 students per cohort, and the students earn a Master of Science in Physician Assistant Studies. You'll apply to the program through CASPA, which is the Centralized Application Service for PAs. Our program, the graduate program, is a 2-year program. The first year is didactic, time spent in the classroom, and the second year is clinical education. And then it says down here in italics, for the clinical year, we have affiliation agreements with multiple hospitals and health systems in Pennsylvania. Mercy, Tower, Einstein Montgomery, Cooper, Virtua, to name a few. There are several more. And it looks like even on the West Coast, we have an affiliation agreement with the Navajo Health Systems. So required materials. All your materials, when you apply to graduate school, is submitted via CASPA. And CASPA, as we said, is this centralized application service. It opens on April 30th, and it's a rolling admissions. When you apply on April 30th, usually you have your application submitted and completed by May, and then you'll start getting your secondary applications in June, July, and you'll interview in August, September, October, November, and get a final decision in the winter. So the required materials for CASPA, we ask for transcripts and all your prerequisite courses be completed with an overall GPA of 3.2 and a science GPA of 3.2. We also ask for a personal statement and short answer essays and 3 letters of recommendation. Again, just to point out, our graduate PA program asks for 100 shadowing hours and 500 patient contact hours. We do not require a GRE. So our environment here. University of the Sciences was founded in 1821. It was known as Philadelphia College of Pharmacy. Next year, you decide to come here, you'll be celebrating our bicentennial with us. We're located in University City. We sandwich University of Pennsylvania and Drexel's on the other side. It's a small campus, it's wonderful. Our undergraduate pre-PA class is 19 this year. And we have a very collegial environment. We have a PA club. I'm your program director. So it's a very tight community here. We also have easy access to Center City on the 11 and 36 trolleys if you want to commute in. We have resources to help you excel. We have an academic support service here at University of the Sciences. They provide assistance with tutoring, study skills, virtual study groups, writing assistance. We have a student health and counseling center to help with test anxiety and adjustment issues coming into the university. We have a career center, a writing center, peer support, and then faculty support. And thank you very much for your time. I included my email address if you have any questions or comments, or if you would like to have more information, please send me an email and I'd be more than happy to provide that to you. Thank you very much for your time.
Thank you, Andrea. It does look like we received some questions in the chat. I know some of them were more admissions related, so I did answer some of those students' questions, but we do have some, pre-PA questions that I want to, get answered. So if we have a couple more minutes, I have a question from a student, and they're asking, when is the application deadline for the 3+2 program?
When is the application deadline for the 3+2 program? So the 3+2 program doesn't necessarily have an application deadline. The way that it works is that everybody comes in the same with the same admission criteria. If you decide that you want to be in the 3+2 program, you will follow the 3+2 curriculum worksheet that I showed. And if you send me an email, I can send you a copy of it so that you can take a closer look. And what you'll be doing is you'll be applying to CASPA in the spring of your second year if you have met all the requirements. I hope that answers your question.
Yes, thank you. And if that question was directed to more my side of the admission side, just applying to University of the Sciences, UScience for the undergraduate programs, we are rolling admission. So there's no deadline to apply to the university. And then just like Andrea said, applying in your second year to CASPA would be for the professional phase of the program if you're applying for the 3+2 program. Some other questions that we received. I have a question about the 85% reimbursement. I know that you were talking about with physicians and then comparing it to the PA. So can you talk a little bit about that reimbursement and what that means?
Well, with the reimbursement, but that's really going to depend on which insurance companies you decide to work with. But generally speaking, it's about salary. So when we talk about schooling and how much time it goes to school, how much time it takes to go to school to become a physician versus a PA, I talked about the average salary of a physician assistant, and it's around $110,000, whereas the average salary of a physician is around $200,000, depending on the specialty. So I hope that helps answer the question.
Another question that we received was about the pass rate for our graduating program. Do you have any stats on that? I know it's a new program, so maybe you can just talk a little bit about that.
No, that's a great question. And it is a new program. And historically, our numbers have been very good. I've spoken with Gus DeStefano about this in the past, and it's over 95%.
And then I have some other questions about shadowing. So the one question is, would shadowing a pharmacy technician, would that count towards patient and contact hours?
Shadowing a pharmacy technician would not count towards shadowing hours. And here's why. So when I explain it this way, it'll put things in perspective. When we ask you for shadowing hours, we want you to get an experience that the physician or the PA gets. And because the specialties are very closely related, doctors and PAs work together, we want you to shadow a doctor or a PA so you get that experience working alongside of them.
And then I have another question about shadowing hours again. And the question says, do we start our 50 hours of shadowing in the summer of 2021 if we're attending in the fall of 2021?
That's a great question. And the short answer is yes. A lot of students use their summer break and their winter break to get their patient contact and shadowing hours. Yes.
I see a question on there for more admission side. I see some questions about SAT scores. So this year, if you're a senior applying to University of the Sciences for any major, again, including the pre-physician studies program, we are test optional for those seniors applying this year. So you do not need to submit your SAT or ACT test scores. If you have them, you're more than welcome to submit them. Submitting your SAT or ACT test scores this year can only help you. It's not going to hurt your application. If you're a junior in the audience tonight, connect with us next summer. I can't guarantee that we'll be test optional again. Hopefully we are, but we're definitely going to be reevaluating that over the summer. So stay connected with us and reach back out to the admissions office. And then let's see, I have some other questions. Again, more about shadowing. It says, would shadowing an optometrist be considered shadowing hours?
Yes.
Awesome. And then are shadowing hours and patient contact hours cumulative?
Absolutely. Absolutely. And, I just want to make a second part to the statement about the optometrist. And I said, absolutely. I want to make sure that everybody understands that different PA programs have different requirements. So I say yes, but you may find a program that says no. So please, whatever I'm saying, it is not the is all end all. Please make sure you look into the programs. And to answer the question, yes, of course it is cumulative. Yes, we want you to build on top of your patient contact and shadowing hours. and hopefully at the same institution and with the same healthcare providers so you can establish relationships with them.
I have a lot of questions about shadowing, I guess, tonight. I have, would shadowing and NP be considered shadowing hours? And then I have someone else talking about they should have specified and said that they worked in retail pharmacy, and they were just wondering, would those hours count as direct contact hours?
Okay, so again, it really depends on the institution. If you asked me personally, shadowing a nurse practitioner would count, I would personally say yes, but I'm not the person making that decision. So you need to look into the program. Most programs will say, without a doubt, shadowing a physician or shadowing a PA, and it is definitely going to count. And my recommendation to you is to try and shadow a PA, because that's what you want to be, right? And the sooner you start networking with PAs, the better off you'll be for it, I think. So it's a wonderful opportunity if you can find a PA, shadow a PA.
Then I have two questions relating to COVID and shadowing. Just given the current climate, it might be difficult. So do you have any words of wisdom or any suggestions to students thinking about shadowing and needing those hours and what they could potentially do?
Now, Christine, that's a great question. That's a question that I'm getting asked every single day from the students at the university now, because it is very difficult to get shadowing and patient contact hours during COVID. We have the university, the graduate school, and other PA schools across the country have made exceptions this year, understanding that students aren't getting their patient contact hours. And so people realize that. And secondly, I want to add that there are virtual shadowing opportunities online if you're interested in doing that. And then thirdly, what we do is we use our own network, right? So for our students at the university who are on campus, I've reached out to local hospitals in the area, and they have found opportunities. So we do help students find opportunities for shadowing.
Awesome, thank you.
You're welcome.
And then I have another question. It says, can you suggest any online shadowing websites? And how would you find like those virtual websites?
My best advice to you is to look at the virtual shadowing websites. You could just do a general search. If they're asking you to pay, do not do it, because it should not require you paying any money out of pocket to do any kind of virtual shadowing. So that's a surefire way to find out if they're legit or not. And then secondly, if you're serious about doing the virtual shadowing, I would ask the school that you're interested in applying to if they think that that is a legitimate virtual shadowing site.
So I don't have any other questions in the Q&A chat. So I'll give the students just a couple more seconds to put their questions in. But again, you have your email on the screen as well. So students, if you have any additional questions or follow-up questions, you can always reach out to Dr. Andrea Garcia. And again, if you have any questions on the admissions side of things, please feel free to contact the admissions office. The admissions email is admit, ADMIT, at USciences.edu. It's also on the website as well. You can email admin and we'll get you connected to your admission counselor, and we'll be more than happy to answer any of your questions and walk you through the application process for the Pre-Physician Assistant Studies program here at USciences. And I don't see any other questions in the chat. Oh, I have one more. I see.
Okay.
I see the call is being recorded. When can I find the recording? So that's a great question. We are recording this evening. We do want to put this recording on the website. So if you have relatives that couldn't attend tonight, you want to show parents in the next couple of days, you can find all of our webinar recordings on our website. You can find them on the admissions site. Just give us a couple of days to put it on the website. It'll take a day or two to process it, but it will be on the website very soon. But thank you so much for attending this evening. Please feel free to reach out to, again, Dr. Andrea Garcia. Thank you so much. And then please feel free to reach out to the admissions team with any additional questions. Thank you so much for joining.
Thank you, Christine. Everybody stay safe, be well.